Did you hear what I said? I said 10 years old, y'all. And let's look at this because a common misconception is it's usually white women that have the highest risk. But a new study looking only at women, researchers from Boston University and Howard University have identified Black women aged 18 through 65. That's pretty much all of our adult life to have the highest risk for suicide, irrespective of their socioeconomic status. And the researchers concluded this. Results from this model continue to highlight racial disparities in health outcomes and the need to approach public health interventions through a racial justice lens. You cannot tell me that there is not a connection between our health and our race. Our communities are always being disparaged with health insurance, health, mental health, being able to go and pay. Because a lot of times people say, I can't afford therapy. Even when it's a sliding scale, I can't afford therapy. You can't tell me that there is not a connection to that. I would love to hear your thoughts on that. Our wealth expert here, Athena, I know you deal with a lot of taxes and things of that nature, but you mentioned that thank goodness your dad had good insurance. So can you explain how you might feel how this could disparage our community?
I'm glad that you brought this up because a lot of people don't understand, and a lot of women don't understand how wealth impacts you in a day-to-day basis. You only think about wealth from a money perspective, but it permeates every aspect of your life. So for example, women on average, right, when we take off to do caregiver duties on average throughout the lifetime, that's about $1 million worth of wealth we sacrifice to take care of the family. When a woman gets divorced, half a woman will experience a loss in lifestyle, and 25% of those women will fall into poverty. When it comes to health issues, like we discussed right now, your financial as a woman will depend on the mental health, the kind of care you can get in birth, the kind of treatment you can expect in that regard. I said, thankfully, I had my dad's good insurance, even though the company does offer me insurance, but I was still under the age of 26. I was still on my parents' plan, and my dad really, really had that great insurance. For the longest time, though, I was hesitant to go to the therapist office because initially I thought I just couldn't afford it. But it got so bad to the point I said, F it, I'm just going to go because at this point I'm like fighting for my life. And to my surprise, when she ran everything back, she said, I don't know what insurance your dad has, but you don't have to pay anything. So I was like, oh my God. And just to put things into context for people, the premiums, because I checked online to see what it would have cost, $195 per session. So I was getting about $800 worth of therapy every single month. Okay. So, thankfully, I was in that position, but how many women have to decide whether or not I'm going to feed my children, whether or not I'm going to be able to feed myself versus get this mental care that I need? Oftentimes, therapy is not looked at something positive. Even when I had to go, my parents were not receptive about that at all. They were saying things like, oh, I thought I raised you to be strong enough to handle life situations. And, they were not supportive. My family was not supportive whatsoever. The only person that was supportive was my ex-fiance. Thankfully for him, I think like he helped save my life. But I want women to understand when we're discussing wealth things, and especially as high performing women, everyone looks at us as we got it. We have things under control. So no one feels like they need to step up and provide the support. And oftentimes we feel ashamed to even ask for the support because somewhere along the line, we got parental or familial or society messaging saying that we were weak for requesting this, or we should have been okay. Or like my parents said, oh, I didn't raise you to be this way. But oftentimes we need it the most because we're often taking on the burdens and muling.